Hello everyone. Today we are going to study about rehabilitation of impaired person. All hearing impaired individual need some sort of oral rehabilitation for communication. The various means available to them are: first is the instrumental devices and the second part is the training. In instrumental devices it consists of two parts. One is the hearing aids, second one is the implants. In hearing aids we have conventional hearing aids, bone anchored hearing aids and implantable hearing aids. In implants we have cochlear implants, auditory brainstem implants and assistive devices for the deaf. Training consists of speech, which is also known as lip reading, auditory training and speech conservation. Now first we'll start with hearing aids. In that, conventional hearing aid. A hearing aid is a device to amplify sounds reaching the ear. Essentially, it consists of three parts. One is the microphone, second one is the amplifier and the third part is the receiver. The microphone picks up the sounds, converts them into electrical impulses. The amplifier magnifies those electrical impulses and the receiver converts those electrical impulses back to the sound, and that is carried through the ear mold to the tympanic membrane. Now, what are the types of hearing aid? First is air conduction hearing aid. In this type, the amplified sound is transmitted via the ear canal to the tympanic membrane. Whereas in bone conduction hearing aid, instead of receiver, it has a bone vibrator which snugly fits on the mastoid and directly stimulates the cochlea. This type of aid is especially useful in persons with actively draining ears, like in otitis externa or atresia of ear canal, when the ear insert cannot be worn. Now, types of air conduction hearing aid. First one, it is the body worn type. It is the most common type that is used. The microphone and the amplifier along with the battery are in one case worn at chest level, while the receiver is situated at the ear level. The second one is the behind the ear type. Here the microphone, amplifier, receiver and battery all are in one unit which is worn behind the ear. Spectacle type, it is a modification of behind the ear only, wherein the unit is housed in auricular pattern of spectacle frame. Fourth, it is in the ear type. The entire hearing aid is housed in an ear mold which can be worn in the ear. The fifth part is the canal type. The hearing aid is so small that the entire aid can be worn in the ear canal without projecting into the concha. Now we'll understand what are the indications for hearing aid. First, sensorineural hearing loss which interferes with day-to-day activities of person. Second, deaf children should be fitted with hearing aid as soon as possible for development of speech and learning. In severely deaf children, binaural aids, one for each ear and individually fitted, are most useful. Training in lip reading is given simultaneously. The third one, conductive deafness. Most of such person can be helped by surgery, but hearing aid is prescribed when surgery is refused or not feasible or has failed. This is the picture showing the types of hearing aid. First one is the body worn type, second one is behind the ear, third one is the spectacle type, fourth one is in the ear canal type. Now, fitting of a hearing aid. While fitting a hearing aid, consideration is given to the degree of hearing loss, configuration of hearing loss, that is the type of frequency that is affected, type of hearing loss, whether it is conductive or it is sensorineural, uncomfortable loudness level, age of the patient, condition of the outer and the middle ear and cosmetic appearance of the aid. Now what is cross? Contralateral routing of signals. In this type, the microphone is fitted on the side of deaf ear and the sound thus picked up is passed to the receiver placed on the better ear. This is useful for person with one ear severely impaired and helps in sound localization coming from the side of deaf ear. Now, bone anchored hearing aids are being preferred for single-sided deafness and have replaced the use of cross aids. Now we'll start with bone anchored hearing aids, BAHA. Now, BAHA is a type of hearing aid which is based on the principle of bone conduction. Here Baha is used as surgical implanted abutment to transmit sound by directly conduction through bone to cochlea, bypassing the external auditory canal and the middle ear. Now it also has three components: titanium fixture, titanium abutment and sound processor. Now the titanium fixture is surgically embedded in the skull bone with abutment exposed outside the skin. Titanium fixture bonds with the surrounding tissue in a process known as osteointegration, and the sound processor is attached to the abutment once osteointegration is completed, which usually takes 2 to 3 months after the implantation. And the Baha transmits vibration to external abutment, which further vibrates the skull and the cochlea. Now what are the indications for Baha? When air conduction hearing aid cannot be used, as in canal atresia, congenital or acquired, not amenable to treatment, chronic ear discharge, which is also not amenable to treatment. Second one, conductive or mixed hearing loss in cases of otosclerosis, tympanosclerosis, and only in those cases where surgery is contraindicated. Third one, it is a single-sided hearing loss. Now, implantable hearing aids. Implantable middle ear hearing aids represent a new category of hearing devices that work on a direct drive principle. Rather than delivering acoustic energy into the external auditory canal, as in traditional hearing aid system, directly drive middle ear implant system use mechanical vibrators that deliver directly to the ossicular chain while leaving the ear canal completely open. In those cases, we were seeing that ear canal, external ear cochlea, that all has been used. But in implantable hearing aids, directly to the ossicular chain, vibrations go. Implantable middle ear devices are generally available in two types: piezoelectric devices and electromagnetic hearing devices. Now we'll go with the implants. Cochlear implant. Cochlear implant is an electronic device that can provide useful hearing and improved communication abilities for persons who have severe to profound sensory neural hearing loss and who cannot benefit from hearing aids. A cochlear implant works by producing meaningful electrical stimulation of auditory nerve, where degeneration of hair cells in cochlea has progressed to such a point that amplification provided by hearing is no longer effective. Components and functioning of a cochlear implant. It consists of external component and internal component. External component consists of an external speech processor and a transmitter. The speech processor may be body worn or behind the ear type. Internal component, it is surgically implanted and comprises a receiver or a stimulator package with an electrode array. Now the principle of cochlear implant. Here we can see, we have also labeled the diagram where we can see the first one indicates the external speech processor captures sound and converts it into digital signals. Second one, it is a processor that sends digital signals to internal implant. Third one shows the internal implant that turns this electrical energy, sending it to array inside the cochlea. The fourth one projects the electrode stimulating hearing nerve, bypassing damaged ear cell, and brain perceives these signals, which we can hear as sound. Now evaluation. Thorough evaluation of patient is very critical in selection of candidates for cochlear implant. The main purpose is to determine if the patient is medically and audiologically suitable for an implant. Medical evaluation. All candidates must be fully vaccinated against meningitis, particularly Haemophilus influenza type B, pneumococcus, and in some areas meningococcus. Imaging of temporal bone, cochlea, auditory nerve and brain is carried out using CT and MRI. Speech and language evaluation is required to assess a child's communicative status and to determine any developmental language or articulation disorders. Psychological evaluation is performed where there may be concerns regarding the cognitive status or mental function of the patient. Now, surgery. Principle of cochlear implant surgery is to place the electrode array within the scala tympani of cochlea. This allows the electrodes to be in close proximity to the spiral ganglion cells and their dendrites. Surgery is carried out in general anesthesia, similar to mastoid surgery. Once patient is positioned, prepped and draped, the position of device is marked and incision is planned. Flaps are elevated carefully so as not to disrupt the blood supply. Usually, two-layered approach is chosen using a flap of skin and subcutaneous tissue followed by a second layer of musculoperiosteal flap. Pocket is created under the second flap and a well or a recess is drilled in the bone to house the receiver or the stimulator. Now, what can be the complications for cochlear implant? Facial paralysis, wound infection, wound dehiscence, flap necrosis, electrode migration device failure, CSF leak, meningitis, post-operative dizziness or vertigo. Exposure of device and extrusion, pain at the site of implant, migration, displacement of device, late device failure or otitis media. Now the second one is a auditory brainstem implant. This implant is designed to stimulate the cochlear nucleus complex in the brainstem directly by placing the implant in the lateral recess of fourth ventricle. Such an implant is needed when the cranial nerve number 8 has been severed in surgery of vestibular schwannoma. Assistive devices, assistive listening devices and system, alerting devices and telecommunication devices. Now training we have speech reading, earlier called as lip reading. It is an integrated process to understand speech by studying movements of lips, facial expression, gestures and probable context of conversation. Auditory training, it enhances listening skill and is used with speech reading. Patient is exposed to various listening situations with different degrees of difficulty and taught selectively to concentrate on speech sounds. Speech conservation, in sudden, severe or profound hearing loss, person loses the ability to monitor his own speech production. As a result, defects arise in articulation, resonance, pitch and volume of voice. Speech conservation aims to educate such a person to use his tactile and proprioceptive feedback systems to monitor his speech production. Hope this was useful to you all. Thank you.